September is Prostate Cancer Awareness, the second most common cancer in American men. The American Cancer Society estimates more than 160,000 new cases will be diagnosed this year, and more than 25,000 people will die from the disease. About 1 in 7 men will be diagnosed with prostate cancer during his lifetime. Joining us this morning to talk about some of the symptoms and the importance of testing is Dr. Joseph Wagner, Urologic Oncology and Minimally Invasive Surgery, Hartford Healthcare Medical Group Director of Robotic Surgery at Hartford Hospital. It's great to have you with us here, Dr. Wagner.
Thanks for having me.
First of all, I do want to talk about the latest study, which just released hours ago, that PSA screening for prostate cancer patients do indeed save lives.
Yeah.
And this is quite a reversal from what we have heard in the past. I mean, there's been some conflict about PSA screening.
Yeah, I think that's true. It's certainly a reversal here, not so much in Europe. So there's been 2 major studies looking to see whether or not prostate cancer screening saves lives. One is ERSPC that was conducted in Europe, and then the PLCO trial here in the United States. The United States trial didn't show any benefit to screening, but it was heavily criticized because there was a lot of crossover, meaning the men who weren't supposed to get screening did on the side with their doctors. The RSPC trial was more pure, and that trial initially showed a 20% reduction in prostate cancer death rates, whereas the United States trial didn't. So now some investigators went back, restudied both of those studies, and came to the conclusion that it looks like there's about a 25 to 33% reduction in prostate cancer deaths for men who are screened at the appropriate age.
Right, and this mostly affects African-American men and men with a history of cancer, is that right?
Well, they're at higher risk.
Higher risk.
So if you have a first-degree relative, meaning a brother, a father, you're at a higher risk. It almost doubles your risk, actually, and African Americans have a high risk as well.
What exactly is PSA screening for those who do not know?
So PSA is a protein. It's a blood test that we can measure in your blood, and your prostate measures it. And there's a number of things that can cause your PSA to be elevated: an enlarged prostate, inflamed prostate. Some men just leak more PSA for reasons we don't understand in prostate cancer. But you get the test done, then have a discussion with your doctor on what he thinks the risks are and what the next steps are. And that could either be a biopsy, another blood or urine test, an MRI, etc. It depends on the scenario.
So you recommended men have the PSA screening?
Absolutely. I mean, men right now, the American Urologic Association recommends that men aged 55 to 70 undergo screening. And high-risk men, meaning African Americans or men with a family history, perhaps start at age 40.
Let's talk about treatment. What is there available?
So it's a wide spectrum. The main standards of care, I would say, are active surveillance, which is just keeping an eye on the cancer, surgery or radiation. And there are other treatments, but they're a little less standard. And depending on the man's age, his health, his PSA, the number of biopsies that show cancer, how aggressive does the cancer look under the microscope, that tends to lead toward or help with the decision-making process on which of those options is best for that individual.
And treatment just slows the process, is that right?
Well, it cures.
It does cure as well.
Yes, I mean, we're hoping to cure. So for the active surveillance patients, we're hoping they never need anything. And in our study at Hartford Hospital, we've shown that only about 33% of men that embark on active surveillance ever go on to need definitive treatment. Most of them can just keep an eye on it. And once they're old enough, we move from active surveillance to watchful waiting. Active surveillance means occasional biopsies, rectal exams, monitoring the PSA. Watchful waiting, which we start at roughly age 75, we're just keeping an eye on these guys and hoping nothing happens, and it usually doesn't.
Dr. Wagner, thanks so much for joining us. We
Thank you.
appreciate it. Lots of information there.